until just a very few years ago with the implementation of EMR systems, paper folders were the standard. So now we've come so far, so many changes. How do you communicate? How do you connect all the various factions within the healthcare system between the patients, the practitioners? So tell us about what you do at TigerConnect, how you're working to solve the problem, and how all these issues and stress relate to nurse burnout.
Yeah, I think, what we're really trying to do, and most especially for nurses, is give them a platform where they can communicate with the people they need to communicate with in order to take care of their patients, but then also connect them in a meaningful way to the nurse call systems that exist in hospitals that are connected to patients, but then also connect them to the patient monitors that are in the room. And you may go into a hospital today and one that may not have technology like TigerConnect and find that nurses are not connected in a meaningful way to these devices, meaning there's no real way for them to reach out to the physician taking care of their patient. Maybe they have to page them. They may not be connected to the monitors in a patient room. So there might be a monitor beeping in this room and another room where they have a patient in. They're not necessarily connected to the nurse call machines that are in the room. So if a patient is in need and is asking for something, there might just be a light blinking outside the room with no context for what that patient needs. So what ends up happening is all of this creates a very stressful environment for the nurse because there's a lot of noise, there's a lot of false alarms, and they don't have a situational awareness as to what is going on with each of their patients in real time. So that's what we're attempting to provide the nurses at TigerConnect is through a very simple user interface on their phone, connect them to the people they need to be connected to, and then connect them to the monitors and the nurse call systems that are connected to their patients and give them a view. Hey, if I have a half a dozen patients that I'm taking care of every day or this day or this shift, this is exactly what's going on with them in the current moment.